It's
Okay, so
recording.
it's been, what, a week since we took the tibial pins off?
I think so.
Okay.
A
So
week and
here's our puppy again. It's been about a week since we removed the transtibial pins. She can walk, but it's funny looking. She's hyperextending both stifles. You can bend her knees, but when she bears weight, she's hyperextending and rolling the knee out. So we're going to put on a little hinge apparatus today. Look at you. Yeah, good puppy. Can you lay down? Let's see if she can get up. She pulls herself up by her front feet. Okay. That's good. Okay, so we had these two hinges made with some pinholes, pre-existing pinholes. The hinges will go to 145 degrees maximum extension, and we're going to use these on the lateral aspects of both legs to prevent the hyperextension and hopefully the outward rotation. So we'll see how that works. Okay, so what's happening here is when she stands up, she's hyperextending her stifle, and I can flex it, although it's very tight. I'm sure her extensor muscles are probably pretty contracted because she hasn't been flexing the stifle, but that's about as far as it really wants to go, and that's pretty firm pressure. It's pretty impossible to tell exactly where the patellas are at this point. Now, the longer I do this, the more I'm getting flexion-wise. It's pretty hard to tell where the patellas are, so I'm going to actually explore the knees before we put the external fixator on to make sure that they're not luxating. And they are just now calcified, whereas we can start seeing them on film. I can feel the patella, but these knees are so round it's hard to tell where the end of the femur is. So what happens is when you first try to put weight bearing, at least it's doing it. This is what it's doing when she stands up. It's buckling backwards. So we're going to try to make it so that can't happen. That's the left leg. Let's roll her over. She might be getting light, Harley. I don't know. Okay, so here's the right leg. Same situation. Stifle's bucked backwards. I can bend it this way. I can flex the hock. And this is as far as it really wants to go. Although as I hold it here, I can feel it stretching. So I think we're going to be doing some physical therapy with this dog. You can see the hock, at least that joint is starting to collapse a little bit. And once again, I can feel the patella. This one feels better. It feels like it's more centered on the end of the femur, but we'll know in a few minutes. Okay, so that versus what we want is this. Okay, so here's the right leg with the hinge attached and the pins going through the holes. And that's about the most flexion that I can get on her right now. And of course the hinge will only allow 145 degrees of extension. On this leg, the right patella seemed to be intact. It wasn't luxating, so that's all we did was just... So this is going to allow a certain amount of flexion at the stifle without hyperextension. Okay? The cement, we just basically pushed a section down on top of these pins and then wrapped it around underneath and kind of interdigitated it around these pins and stayed away from the hinge. And that should hold, I would hope.